Hi, my name is Liz, and I'm 40 years old. Last year, about 9 months ago, after two very early miscarriages around 5 weeks, I had some testing done and I received a diagnosis of diminished ovarian reserve with an AMH level of 0.19. And I was already trying a number of tools to get pregnant, including acupuncture and supplements and an elimination diet. But I wanted to add another tool to the toolbox. We wanted to exhaust all of our options before we would consider fertility treatments. And so I joined FAM in late August, early September of last year. And I first noticed that it was helping my digestion. I did the acupressure protocols religiously a couple of times a day, and would also occasionally do some of the other techniques, but really did a lot of the self acupressure. And so I noticed it was helping my digestion, and then I started to become hopeful that it would help my fertility. And about 10 weeks after joining FAM, I became pregnant, and I was thrilled, obviously, and um, yeah, was sort of in shock at first that this could have helped. And obviously, I was trying a number of things, as I mentioned, but I do think FAM was a really, really important part of my fertility success. And judging by the way that I felt better after starting it. And so I'm grateful for the role that it played in my fertility. And I'm 18 weeks pregnant now with a healthy baby. I'd say I joined FAM because I wanted to be able to do something to help myself. So I was seeing different practitioners like an acupuncturist and a Reiki therapist, but I really wanted something that I could do at home to sort of take charge of things to the extent that one can even take charge of their fertility. But that part was appealing to me. And I also felt that the acupressure protocols were really manageable and they just really appealed to me. I like that there were different ones for different phases of the cycle and for different symptoms or issues. My issue was diminished ovarian reserve, and I had two early miscarriages. Um, then I received the diagnosis of diminished ovarian reserve with an AMH of 0.19. 2 months after that, I joined FAM, and about 10 weeks after that, I was pregnant. So in addition to getting pregnant, which was obviously the goal, I do think it really helped my digestion. So that was actually the first sign for me that something might be shifting, because my cycles had always been pretty regular, so that wasn't a way that I could really track things. But the changes in my digestion were really encouraging and were something that I hadn't seen with anything else that I had tried, which is why I do think that FAM played an important role in my fertility journey. I tried, like I said, I tried a lot of things, but I do think FAM was a really important component of what eventually helped us get pregnant. I was really happy to find out that I was pregnant, and it was surreal also because we had been trying for about 11 months and had this really discouraging AMH level. So I really didn't think that it would happen naturally. I was thrilled that it did. Really nervous at first, but feeling good now with an anatomy ultrasound the other day that was really positive. So it felt great, and I'm grateful that to FAM and to Heidi for this tool that I think was an important part of my journey.